In the case of Alzheimer's disease, everything we do to avoid it before suffering from it is convenient. The disconnection of the will, of the emotions makes treatment very difficult because the most interested person, who is the patient himself or herself, remains disinterested in those who assist and care for him or her come to believe that what they do is against the patient's own will. Whom every day distances himself or herself more than what was once his routine. Alzheimer's disease, known as AD, is the most common form of dementia among older people. Dementia is a brain disorder that seriously affects a person's ability to carry out daily activities. AD begins slowly. It first involves the parts of the brain that control thought, memory and language. People with AD may have trouble remembering things that happened recently or names of people they know. A related problem, mild cognitive impairment, MCI, causes more memory problems than normal for people of the same age. Many, but not all, people with MCI will develop AD. In AD, over time, symptoms get worse. People may not recognize family members. They may have trouble speaking, reading or writing. They may forget how to brush their teeth or comb their hair. Later on, they may become anxious or aggressive, or wander away from home. Eventually, they need total care. This can cause great stress for family members who must care for them. AD usually begins after age 60. The risk goes up as you get older. Your risk is also higher if a family member has had the disease. No treatment can stop the disease. However, some drugs may help keep symptoms from getting worse for a limited time. Many people don't know it yet and others resist for fear of finding out something they don't want to know or have. If someone in your family has or has had Alzheimer's, the risk for some family members is greater when compared to other families without such a family history. The medical sciences recommend everyone rule out or detect early the risks of suffering from Alzheimer's disease early or late. The APOE gene contains instructions for making a protein called apolipoprotein E. This protein helps control the levels of cholesterol and fats in the blood. It is not known exactly how the epsilon-4 variant increases the risk of late-onset Alzheimer's disease. Knowing the above, it is recommended that everyone know as soon as possible if they have in their genome on chromosome 19 and in the APOE gene, in the variant studied, the change of a thymine nucleotide or letter T for a cytosine or letter C, in the sequence of letters that makes us have a high risk of developing the disease in its late phase. Because it's an easy test to perform and costs less than the cost of a family lunch at any neighborhood restaurant, there's no reason not to have this simple test that requires a simple sample of your saliva. While you decide, I will inform you about some red flags that usually appear before the disease. 10 early signs and symptoms of Alzheimer's. Number 1, memory loss that disrupts daily life. One of the most common signs of Alzheimer's disease, especially in the early stage, is forgetting recently learned information. Others include forgetting important dates or events, asking the same questions over and over, and increasingly needing to rely on memory aids, for example, reminder notes or electronic devices, or family members for things they use to handle on their own. What's a typical age-related change? Sometimes forgetting names or appointments, but remember them later. Number 2, challenges in planning or solving problems. Some people living with dementia may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. What's a typical age-related change? Making occasional errors when managing finances or household bills. Number 3, difficulty completing familiar tasks. People with Alzheimer's often find it hard to complete daily tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. What's a typical age-related change? Occasionally needing help to use microwave settings or to record a TV show. Number 4, confusion with time or place. People living with Alzheimer's can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. What's a typical age-related change? Getting confused about the day of the week but figuring it out later. Number 5, trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast, causing issues with driving. What's a typical age-related change? Vision changes related to cataracts. Number 6. New problems with words in speaking or writing. People living with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have trouble naming a familiar object, or use the wrong name, for example, calling a watch a hand clock. What's a typical age-related change? Sometimes having trouble finding the right word. Number 7. Misplacing things and losing the ability to retrace steps. A person living with Alzheimer's disease may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. He or she may accuse others of stealing, especially as the disease progresses. What's a typical age-related change? Misplacing things from time to time and retracing steps to find them. Number 8. Decreased or poor judgment. Individuals may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money or pay less attention to grooming or keeping themselves clean. What's a typical age-related change? Making a bad decision or mistake once in a while, like neglecting to change the oil in the car. Number 9. Withdrawal from work or social activities. A person living with Alzheimer's disease may experience changes in the ability to hold or follow a conversation. As a result, he or she may withdraw from hobbies, social activities, or other engagements. They may have trouble keeping up with a favorite team or activity. What's a typical age-related change? Sometimes feeling uninterested in family or social obligations. Number 10. Changes in mood and personality. Individuals living with Alzheimer's may experience mood and personality changes. They can become confused, suspicious, depressed, fearful, or anxious. They may be easily upset at home, with friends, or when out of their comfort zone. What's a typical age-related change? Developing very specific ways of doing things and becoming irritable when a routine is disrupted. Get checked. Early detection matters. If you notice one or more signs in yourself or another person, it can be difficult to know what to do. It's natural to feel uncertain or nervous about discussing these changes with others. Voicing worries about your own health might make them seem more real. Or, you may fear upsetting someone by sharing observations about changes in his or her abilities or behavior. However, these are significant health concerns that should be evaluated by a doctor, and it's important to take action to figure out what's going on and what is happening without us being able to see it. A plaque is an abnormal cluster of protein fragments. Such clusters can be found between nerve cells in the brain of someone with Alzheimer's. A microscope will also show damaged nerve cells. In them are tangles called neurofibrillary tangles. These consist of twisted strands of a different protein. Together, the plaque and tangles cause structural and chemical problems. It appears that Alzheimer's disease causes parts of the brain that normally work together to disconnect. Although it seems strange to some, doctors have been trained to connect the signals at a glance, and the criteria of an experienced doctor can help you a lot. If you manage to understand the origins of the disease, the gene we mentioned has the function of regulating high or high-density cholesterol, which in turn is a protector of the cardiovascular system in our heart. If you value your life and have checked your health frequently, you should have blood tests where the figures for high-density lipoproteins show whether they were normal or low. Also, the medications that are used to reduce the symptoms that occur in Alzheimer's disease, there is one that is an aspartate antagonist. And aspartate is, among other things, an enzyme that rises when there is damage to the liver, heart, and tissues. In order not to confuse you more, I want you to know that you are a psychological and social biological being, and circumstances make you create beliefs. And those beliefs then create a safe or not so safe environment for you. Get checked. You must value your life as long as you have that opportunity. There are people who never read or find out anything if you don't tell them. Please tell them. They or their relatives will probably thank you someday.